Lepas tu 92 jam. 95 dah lagi pendek. So selalunya kalau petir ni kat bilik kita kat sini je, dia takkanlah affect sangat sebab desibel dia pun mungkin sekejap je, 85 ke apa. Unless you memang, I don't know, dekat dengan the petir yang I tak rasa sebab it's too far untuk dia bising, untuk dia terlalu kuat. Sekejap. And also dia tak macam contohnya kan, you duduk tepi, okay, you are next to a bell, yang macam emergency bell tu, dia macam above contohnya 100 decibel. Then you akan ada instant kepekakan.
And is that permanent?
That will be permanent. Because ingat tak bahagian telinga yang nombor 3, which is dalam telinga tu, ada rambut tu. Rambut tu dia mati, dia akan mati kalau terlalu kuat, yang beyond dangerous decibel, ataupun dia selalu sangat bergerak, macam you pergi tempat bising selalu, ataupun you kalau thunderstorm tu macam over and over again, which that doesn't happen really, over and over, dan dia akan matilah over time, dia wear and tear. So again, mitos.
So kalau bunyi tiba-tiba lah teringat kan, because dah 1 tahun kan Gaza kan, so they have multiple bombs kan, so tu bunyi dia kuat kan?
Yes.
So it's especially kids lah, so probably diorang punya hearing.
Dia bukan kids je, everyone, especially when talk about like people in Gaza. So obviously memang those are memang diorang sangat-sangat prone to having hearing impairment. It's not just hearing impairment, ear aches, because when it's too loud, you pecah kegenan telinga you. So memang kalau bombings, or like kita cakap pasal like macam even people yang masa dekat London, they had like a bombing, not even scared, it's real bombing dekat train station. They all had hearing loss. All lah, majority yang memang dekat dengan bombs, they actually have hearing impairment. Bukan hearing impairment lah. And some of them are my patients when I was in St. Mary's Hospital. So it's something that is
orang pasal macam you kata, is unseen, apa perkataan?
Called invisible disability.
Invisible visibility, because contohlah kalau kat kita lah kan, kat Malaysia ni, kalau you pergi macam open market kan, macam pasar malam, pasar borong, so sometimes dia pasang that macam paper lama.
Paper lama, kalau lebih 80 dB.
Yes, beli.
8 jam setiap hari boleh ada hilang hearing. Basically that's it.
So kalau kita kendong anak ke apa, kita lupa kan bunyi yang kuat tu.
Yes.
Kalau kita pendengaran dah kurang, mungkin kita tak rasa benda tu mengganggu kan.
Betul.
So I guess parents be careful when you have high volume kat mana-mana, pasal budak tak reti nak cakap kan. So kita kena be careful about this invisible.
Yes, invisible disability. Tapi basically bila muda, you punya dynamic range is besar. So bila kuat sangat, sometimes kita punya hasil tu boleh control.
Alright.
Tapi nak cakap pasal telinga ni lama, banyak.
Kita patutnya cakap pasal hujan.
I know, hujan.
Are we supposed to finish this off?
Lagi boleh. Allah, ingatkan dah habis
pasal
dah.
Diorang suka tengok muka kita orang.
Okay,
we'll do this
habis
fast.
makeup mak.
Ini pun dah cukup, dah bagi banyak information kan Dr. Shasha?
Ya, hari ni kita banyak fun information.
But it's information that I rasa ramai orang tanya sebenarnya tak berani nak cakap kuat-kuat. Okay, next.
Okay.
Dia orang dah gelak, dia dah tahu apa benda. Kita tak boleh bagi clue kan?
Tak lah kot.
Tak boleh bagi. Okay, macam ni je. One word. Okay.
Tidur, demam. Oh, tu je, demam.
Yes. Oh, pandai.
Apa sebab you bagi dia senang? Okay, demam.
Okay, dia
Alright,
kata
demam. Okay.
penyakit atau simptom biasa musim hujan. Yalah, kan. Cakap budak-budak selalu sakit. Biasanya demam, batuk, sesama.
Betul. But that is very common kan, especially for children kan. Dr. Aida, I want to ask you a question. So macam like, kenapa budak-budak lagi senang? Kenapa budak-budak I see 3 tahun lagi senang demam compared to budak-budak above 3 tahun? And then lagi besar dia lagi kurang. And then at a certain point and adulthood lagi senang.
Okay. Kita kena belajar.
Macam like there's a wave, right?
Yes.
Right?
Kita ada sebenarnya boleh tengok kita punya kadar immunity. So quite high masa lahir, masa kita dapat from our mother. Kalau so ibu-ibu mengandung, kalau jaga kesihatan, makan pemakanan yang sihat, because you nak jaga baby kat dalam tu, dia memang bergantung pada kita punya diet lah.
Yes.
So bila lahir,
diet is very important during, before and during pregnancy.
Yes, before and during pregnancy. Before pun.
Before pun.
Before and during pregnancy, and then after pregnancy is cholesterol. Breastfeeding.
Yes.
So because kita nak continue bagi. And then bila 6 bulan, kita punya the immunity yang mother bagi tu dah makin diminish.
I see.
And they are lowest about 6 months.
6 months ya, mummies.
So masa tu
and daddies, of course.
baby baru je nak bentuk dia punya own immunity.
I see. So the first 6 months of a baby's life, they depend on the mummy's,
the one that the mummy had passed.
So whatever that they had from the mummy for immunity come from the apa cakap ni? The baby would have the immunity from the mummy.
Yes.
For 6 months.
For the first 6 months.
First 6 months.
And then that's why kita encourage breastfeeding, because bila dia dah keluar kan, dia dah tak ada direct contact dengan kita.
Yes.
So the breast milk will help lah.
Yeah, and that also means like a lot of people, I don't know if everyone ada lagi yang tak tahu yang pasal liquid gold.
Yes.
Yes, the colostrum. So colostrum is called liquid gold, but there's no color. It's just colorless.
Dia
Yeah,
so
because
macam betul ke?
betul ke ni susu? Yes, that is liquid gold with no gold. Yes, it's just colorless.
Yes.
But yes.
So so you perasan usually bila habis pantang kan, kita hantar nowadays parents yang kerja kan, so they have to send to babysitter or nursery. So at that time then they will say hantar nursery je dah start sakit, batuk sesemut, sakit batuk.
Betul.
Partly because one, immunity dia paling rendah masa tu, so dia very vulnerable.
Betul.
Second is that when you go to nursery, then there's other kids. So and they are in a room, so dia berpusing kat situ lah. So dia senang berjangkit. Compared to kalau dia duduk kat rumah, you je yang jaga.
Betul.
And then as they produce their immunity, they reach adultnya immunity. InsyaAllah kalau pemakanan dia bagus, 6 months tu kan dah start makan.
Betul.
Dah start makan semua tu, bagus semua tu, they reach about 75% adultnya immunity by about 1 year.
Okay, so meaning after 1 year they are like almost 75%.
75%.
Macam kita adults
dewasa
lah.
punya.
Faham?
But it takes another year untuk reach adult punya immunity.
I see. So by 2 years old dia memang macam adult punya immunity.
Tapi apa isu masa the first 2 years, 2-3 years ni? Selalunya you as a mother, apa isu? Because immunity kita tahu that comes from nutrition.
Yes, dia ada, what I understand from my process of being a founder to products.
Yes.
Apa yang I belajar, and also as a mother, it depends on 3 things. Satu yang memang naturally ada, and then the next one is something yang you kena depend on vaccine. I don't know what's it called. I lupa dia punya term for it. And the other one is you kena pinjam. Maksudnya you kena pinjam, you kena makan.
Okay.
So nutrition tu macam you pinjam, sebab you makan, dia akan hilang, you kena makan lagi. That's why we have supplements, right?
Yes.
To assist our body to increase the immune system. Betul kan? So that's what I learned, and that's what I also do with my children, because memang I see, macam I only have 2 children, but I really nampak betul teori I, and also from reading, after 6 months memang, oh my goodness, kita bayar mahal ya hantar hantar ke baby center.
Yes.
Sebab masa tu pun I belajar, correct me if I'm wrong, but this is what I see. Kalau I hantar awal, dia lagi senang untuk nak adapt to the baby punya environment. Maksudnya dia lagi senang nak masuk ke center compared to kalau I hantar lagi lambat. Yeah, so dia ada apa kata attachment punya issues, right?
Yes.
So I hantar awal. So obviously I rasa macam susahnya nak maintain kesihatan dia ni. Because bayar mahal tapi cuti lagi banyak.
Yeah.
So macam like, okay, my second son I kena lagi careful. So I realised that memang first 6 months is the key to dia akan drop lah dia punya immune system. And then after that, I see that sebab dia makan solids kan, 6 bulan dah makan solids. So make sure that dia makan the right amount of food, cukup everything yang cukup, apa kata, nutrition punya
well balanced
tu dengan cukup greens. Masa tu greens tak ada masalah. But that's when happen, like dah masuk je 2 tahun dia dah start macam tak nak makan greens.
Itu pasal lah. pasal kalau you kata bila 2 tahun patutnya macam adult punya immunity kan.
Yes.
The problem is kita tak boleh nak maintain dia punya nutrition tau, because
Yes.
dia orang start picky eating lah, dia orang start makan benda-benda yang tak berkhasiat.
Yes.
Dia orang tak sekarang ni main indoor je, main komputer je.
Betul.
So dia orang tak dapat matahari. So you're talking about apa? Activation vitamin D.
Yes.
You're talking about getting zat besi.
Activation vitamin D.
zat
Macam mana?
besi.
So zat besi ni macam mana?
Zat besi melalui pemakanan.
Okay, food jugalah kan?
Food.
Okay, alright. So,
Melalui pemakanan. So that's why kalau you perasan less than 2 years old punya makanan, you always nampak diperkaya dengan zat besi.
ya, betul.
So kita kena pandai baca label. Kita kena pandai tengok makanan. So kalau malas lah nak baca, pinggan tu ada banyak colour.
Okay, so colourful meal would be the best for our
Yes.
child. And then that would increase their immunity, right?
InsyaAllah.
InsyaAllah.
Boleh, yes. Makan, aktif, being aktif,
Aktif,
kena gerak, okay. Cukup tidur.
Cukup tidur.
And cukup tidur bukan tidur bila-bila masa. Cukup tidur waktu malam yang where you're supposed to be
Oh, I
resting.
see. So, maksudnya masa malam tu memang kena cukup tidur.
Yes.
Okay, faham.
Kalau you perasan tak kalau you tidur siang lama, compare dengan you tidur malam yang secukupnya, it's different kan?
Betul.
You feel more rested kalau you tidur awal, bangun awal, compared you ambil naps during petang, lepas asar, you akan jadi lembik.
Betul ke?
timing
Sebab I
is
suka
important.
tidur petang sebenarnya. But it helps though for me at this age. Macam
Okay.
lah tua sangat.
Right,
Oh,
the next one.
ya Allah, semua saja.
Is it my turn? No, it's your turn.
I pun nak larikan diri. Macam seronok kan topik
Tak
ni.
boleh, I baru buat macam ni.
Tapi kan soalan dia demam ni je nak lari juga ni. Okay lah, sebentar I buka kan. Tapi itulah, lepas 2 tahun memang you akan nampak memang budak-budak tak suka kan makan sayur.
Kenapa daripada masa awal-awal tu boleh suka makan, tiba-tiba dah tak suka makan. Itu memang pelik ajaib lah. I tak ada jawapan untuk soalan tu. Dr. Aida nak tutup conversation tu, so teruskan.
Dia orang ni suka bagi yang susah kat I tau. Aduh, stres. I tak rasa you boleh dapat ni sebab I macam mana aku nak tunjuk ni. Okay. I try.
Telinga dalam sumbat.
Thank you. Number 2.
Telinga sumbat.
Yes.
Tu je.
Yes. Okay, telinga sumbat. Okay, penyakit atau simptom biasa musim hujan. Telinga sumbat. Okay, telinga sumbat ni macam soalan lah, telinga sumbat kat mana?
I rasa lebih kepada hidung sumbat dulu kot.
So
Lepas tu
hidung
dia
lagi.
masuk kat saluran tu, jadi telinga pun involve.
You think so? Okay.
Jarang lah.
So let's just talk about the topic lah. Telinga tersumbat. So telinga tersumbat ni selalunya I fikir sebab earwax tersumbat. So earwax banyak. Okay. So berbicara cakap pasal earwax ni, kita ramai orang tak tahu kita tak boleh korek telinga.
Yes.
Kita tak boleh korek telinga. Tapi kalau macam sometimes apa yang berlaku ialah telinga tu boleh terlalu banyak earwax ataupun jadi lagi keras. Yang itu you kena pergi jumpa doktor, ENT ataupun GP untuk get it removed. Okay? Tapi sebab topik hari ni bukan pasal telinga tersumbat, kita cakap balik selepas ni. Wait, we will have that topic. But coming back to Dr. Aida tadi, hidung tersumbat. Does it happen during hujan and time sejuk?
It can happen. Satu more common yang those yang sensitive to the weather.
How about sinus?
Sinus is basically most of the time it's a sensitivity to ni lah. Tapi sinuses, orang selalu cakap sakit sinus kan, tapi sinus kat tepi sebenarnya, hidung kat tengah.
So sakit hidung lah. From the
Dia
sinus
dalam,
ke macam mana?
It usually starts from the nose, and then kalau tersumbat banyak sangat, then dia boleh mengalir masuk to your sinuses.
I see. More like that.
Kalau kita ada gambar tengkorak tu, kalau
Senang sikit lah.
nampak lubang-lubang tu semua yang sinuses.
Oh, faham. So Dr. Aida, apa cases yang you selalu jumpa time hujan? Macam time sejuk ni, what's the common children punya demam and sesama punya cases?
Okay. So selalunya kita jumpa kes demam tinggi.
Demam tinggi.
High, spiking, fever. Selalunya and then sejuk menggigil. And then dia akan datang with batuk. Selalunya berkahak. Hidung sumbat. That is the most common. So bila diorang datang, it varies daripada just sesama sakit tekak, pharyngitis, up to pneumonia lah.
Okay, so that's like the worst case scenario, right?
The worst case scenario, kebanyakannya datang macam tu.
Okay.
And these are related to a lot of respiratory viruses lah. Contoh macam influenza, macam RSV. RSV memang
RSV,
suka. Time-time ni memang banyak RSV.
So, can you talk a bit more about RSV?
Okay. So RSV ni, nama penuh dia, respiratory syncytial virus.
I see. So, is that a common virus or is it like...
It's a seasonal virus.
Oh, seasonal virus.
Yes. So the thing is, kalau dekat negara barat, they have the 4 season kan. So it usually peaks masa winter. Because masa cold weather, they thrive.
So that's what you were saying just now.
Yes.
During cold environment or cold weather, some viruses thrive. So, kalau you all yang nak tahu pasal RSV, inilah ceritanya. Basically, time sejuk, RSV ni dia menternak.
Menternakkan dia. Okay, tapi kat Malaysia, kita ni tak ada musim.
Betul.
So, we do have studies where kita ada 2 peak lah. Pertengahan tahun dengan akhir tahun.
Pertengahan tahun dan akhir tahun sebab monsun ke?
Masa monsun akhir tahun kan. Lepas tu pertengahan tahun kan kadang-kadang ada hujan juga kan.
Oh yeah.
So, time-time ni ada peak sikit.
Macam sekarang lah. Kita sekarang ni tengah hujan. So, that means RSV can thrive in this environment?
Yes, can thrive. And we do have a good number of RSV infection, especially those yang high risk kan, yang mempunyai risiko tinggi adalah baby yang pramatang.
Okay, so babies pramatang is
premature babies.
Premature babies.
Kanak-kanak bawah 2 tahun.
Okay.
And dulu masa kerja dekat big hospital dekat government kan, so selalunya kita nampak kita selalu risau untuk baby yang ada immunity problem dengan pramatang. Tapi sebenarnya ada latest paper yang cakap actually I think 90% are actually well children less than 2 years old. So tak semestinya pramatang. So bawah 2 tahun risk.
I see.
Because of their immunity issue.
So sama juga dengan conversation kita tadi sebab dia belum sampai ke adult or 100%, immunity seperti dewasa. So dia memang sangat prone kepada infection. So so basically this is the time where RSV and all other viruses yang mungkin suka thrive in this cold environment will be active.
Yes. So I pula nak tanya soalan.
Oh, I ingatkan dah habis.
Tak ada.
Sebenarnya I nak tanya lagi.
I nak tanya dulu. Lepas tu duduk tanya I banyak kan. So I nak tanya.
Tapi seronok kan nak tahu pasal benda ni sebab it's so common.
Yes.
It's so common. Even anak I yang tak payahlah umur 2 tahun, sekarang 6 tahun, it's like bila dia bersin je I dah macam no.
Pasal it affect macam-macam tau. Kita fikir okay, orang selalu fikir batuk sesama je. Kenapa nak bising kan? Tapi dia kacau your daily life kan.
Betul.
Tak boleh pergi kerja. You kena jaga anak. Kalau anak masuk hospital, anak lagi satu tu nak pergi sekolah macam mana. It actually kacau at least that 2-3 hari punya ni. And then I had parents yang macam Taida kena masuk ke, I tak boleh dah hujung tahun, cuti dah tak ada, nanti kena buang kerja, you know. Tapi kita macam nak kena fokus, anak memang kena admit ke atau kena oksigen ke, benda-benda macam tu kan. Betul. So usually I take opportunity, lepas dia dah sihat, dia datang follow up. I can take opportunity to look back into dia orang punya growth, into dia orang punya activity, into their diet, because then I would say you want to prevent this, you have to look at these 3 basic things. Of course a lot of people ask me about, doktor apa lagi suplemen saya boleh tambah, macam nak bagi vitamin apa, nak bagi ni, nak bagi tu. Tapi dia ada isu-isu lain juga yang melibatkan suplemen, because there is no issue giving supplement. The thing is affordability.
Betul, tak semua orang mampu.
So tak semua orang mampu. So I cakap jaga 3 tu dulu. Jaga pemakanan, make sure dia aktif, make sure tidur dia bagus. Then hopefully dia boleh sendiri naturally improve dia punya immunity.
Betul.
If you mampu. dia sangat susah nak makan. Tu yang paling selalunya orang
Itulah
ada
sebenarnya
masalah.
memang I mean like kenapa kita orang bawa suplemen sebab
Yes.
I did it because my son doesn't like to eat veggie.
Exactly.
So we had to have something else yang rasa chocolate tapi dia bagi nutrition
sama,
vegetable.
Because yang macam the vitamins and minerals yang help with immunity, kadang-kadang saiz budak tu okey tau. Tapi dia okey pasal dia banyak ambil karbo.
Yes.
Makan banyak sangat nasi.
My
semua.
goodness,
So
that sounds
badan
like my
cantik
son.
tapi imun tak bagus.
Betul. Because
there is-
carbo.
Yes,
Carbo
dia banyak
loaded.
karbo atau banyak protein tapi
Yes.
dia tak ada the fruits and veggies.
Yes,
So bila dia tak ada the other elements, kita panggil hidden hunger. Kita akan cakap pasal ni kemudian tau.
Yes, that's a topic.
Banyak-banyak topik.
Tunggu dan lihat.
So dari segi tu kadang-kadang dia merisaukan. That's when supplement comes in. Because sementara you membetulkan cara makan dia, supplement helps.
Faham.
Yes.
Ya.
Tadi bukan I nak tanya you soalan.
Itulah kan seronok.
Dia berjaya nak.
Okay.
Ni I nak tanya you as a mother.
Okay.
Pasal zaman dulu-dulu banyak diorang ibu-ibu zaman dulu-dulu dia ada banyak-banyak home remedies lah. Either remedies masa dah sakit ataupun something to prevent.
Yeah.
Especially musim-musim hujan ni, ada tak yang you dengar atau you pernah experience sendiri?
Okay, so for me, for my kids, definitely honey is something yang I practice. In fact, before I pregnant, during I pregnant, and after I dah, of course, dah besar budak-budak ni, honey is the first thing I bagi diorang. Because it's the most natural. Dia ada antiviral, and dia natural antibiotic, I think. Dia memang sangat-sangat very good. Not just for the kids, it's also for me. So that's the first one, yang natural. Of course, I try my best to jaga pemakanan. If not, then of course, I sendiri pakai, for Zidan memang super olah immune booster. Because dia ada dia ada yeast beta glucan yang you tak boleh nak dapat daripada normal food anyways. And then dia ada colostrum, dia ada all the ingredients yang I need to improve dia punya immune system. And definitely kalau hujan memang tak kasih bayi luar. I don't take risk lah, honestly. But then other than that, I jaga baju dipakai. So kalau macam hujan kan, I mesti bawa extra baju. Because I sendiri tak suka bila basah. And I see that kalau anak I macam ibu rambut basah lama sikit je, kalau malam tidur basah,
Dia akan
start sesama. So of course one of the things that I always dia mesti ada dia punya backpack and ada extra baju. At all times. Cuma umur dah lebih 8 tahun tu tak ada lah. Safa tu dia macam okay. I think that's pretty much it. And of course jaga makan. And if I feel that terlalu carbo loading, I mean like sebab sometimes you kids kan keluar dengan, kalau dengan my home assistant dapat fries,
dia dapat apa dia nak,
dapat apa dia nak benda keropok, macam like mana nutrition dia. Then I know that I need to prepare. Of course, kalau macam I tahu, sebab sekarang ni bukan saja normal flu, and we also have to be aware of like COVID.
Yes.
And COVID goes around lagi. So I may make sure kila mana yang I tahu ada case tu, I try not to send to school lah. Pakai mask lah. And kalau dia sendiri macam I ragu-ragu, I'll get him to wear mask. Even kakak will wear mask to avoid other people.
So kepentingan macam hand washing pun sekali lah kan?
Of course. I think that goes without saying. Macam the good thing about sending children to preschool, hand washing is something yang memang sekolah terapkan. So kat rumah pun anak pun naturally dia akan hand wash. In fact bukan hand wash tau. Kalau anak I, my husband, wash your leg, wash your hands, baru naik atas.
I mean that is without fail kan. Sebelum you baring atas, kalau you daripada luar,
tak boleh
sebelum baring atau
mandi,
duduk kat mana-mana furniture dalam rumah, best is to clean yourself up. Especially kat bilik tidur lah, kat katil kan. Cuci kaki, ajarlah diorang kepentingan kebersihan ni. Macam Nabi pun cakap sebelum tidur pun kena libas-libas dulu benda kat atas katil sebelum tidur. So I think it's very important. This asas ibu bapa. Because I feel that I always cakap, parents yang pernah jumpa I tahu, I selalu cakap go back to basic. You boleh cakap macam which insurance nak beli, which doctor the best, which the ni apa tu semua, but asas tolong jaga.
Terlalu
makan,
penting, betul.
Main diorang, tidur diorang, kebersihan diorang sangat penting. You go back to basic. Okay? Alright.
I think we've covered literally everything. Well, everything that we can talk about hujan and the musim hujan sekarang.
Yes.
So hopefully everybody, if you guys need more, if you have more questions about, I don't know, the current situation, you can drop your question and Dr. Aida mungkin boleh jawab. And if you have any question about hearing, about middle ear problem, kalau still tak faham konsep, boleh tanya. Mungkin kita boleh hantar you more information. Okay, Dr. Aida?
Okay.
Alright, so keep yourself healthy.
You
I
too.
think jangan lupa juga, you pun jangan lupa. Kita semua kena wash hands and be clean before you go on the bed. Yes. I guess that's it lah for today kan?
We had a good session.
I think so. I learned a bit and I'm pretty sure I hope you learned something also.
Of course. Mana? Expert ni.
Oh my god. But anyway, we have something amazing coming next week. So check us. Make sure you follow us on YouTube
Spotify
and
TikTok.
yes, TikTok. Okay guys, see you all next week. Bye.
Beautiful.
Yes, you're so beautiful. I'm so chaos.